Good morning, sir. I am Asujan Weska from BSN 1A, and I am here to demonstrate to you on musculoskeletal assessment, which consists of the range of motion, assessment for gait, muscle strength, and as well as palpating the temporomandibular joint. So let's begin.
So first is we have to palpate for temporomandibular joint. So here we are assessing for movement, sounds, tenderness, as well as pain. We put our index and middle finger just anterior to the external ear opening. Then we will ask the client to open mouth as wide as possible. Then move jaw from side to side. Then protrude and retract jaw. Next is we have to test range of motion of the cervical spine. We'll ask the client to look up at the ceiling and to touch the chin to the chest. Then touch each ear to the shoulder on that side. We will ask the client to turn the head to the right and to the left. So next, we will assess for muscle strength using the MRC scale. We will ask the client to repeat the cervical ROM movements against resistance. Next one is to test the range of motion of thoracic and lumbar spine. Ask the client to bend forward and touch the toes. We have to observe for symmetry of the shoulders, scapula, and hips. Then bend backwards. Then we will ask the client to bend sideways. And twist the shoulders one way then the other. Then we have to assess its muscle strength. Then we have to repeat the thoracic and lumbar ROM movements against resistance. Next is we have to test the range of motion of shoulders and arms. We'll ask the client to stand with arms at the side and then move the arms forward, then backward with elbows straight. Then bring both hands together overhead with elbows straight, followed by moving both hands in front of the body past the midline with elbows. Then have the client bring the hands together behind the head with elbows flexed and behind the back. Then we have to assess the muscle strength. Repeat those maneuvers against resistance. Next is we will test the range of motion of elbows. We will ask the client to flex the elbow. Then straighten it. Turn the palm down, then turn the palm up. Then we have to assess for muscle strength. We will have the client repeat the movements against resistance. Next, we have to test the range of motion of wrists. We will ask the client to bend the wrist down and back. Then we will assess its muscle strength. We will repeat those movements against resistance. Next is we will test the range of motion of hands and fingers. We will ask the client to spread the fingers apart, make a fist, move the thumb away from other fingers, and then touch the thumb to the base of the small finger. Then we will ask the client to touch other fingers using the thumb. Next, we will assess its muscle strength. Repeat those movements against resistance. Then we will test the range of motion of the hips. We will ask the client to raise extended leg. Move extended leg away from midline of body as far as possible and then toward midline of body as far as possible. Flex knee up to chest while keeping other leg extended. Then bend knee and turn leg inward and then outward. Next, we have to assess its muscle strength. We will repeat those movements against resistance. Next, we will assess the range of motion of the knees. We will ask the client to bend each knee up toward buttocks, then straighten the knee. Next, we will assess its muscle strength. We will repeat those movements against resistance. Lastly, we will test the range of motion of ankles and feet. We will ask the client to point toes upward and then downward. Rotate the foot inward and then outward. Next, we will assess its muscle strength. We have to repeat those movements against resistance. And the last part will be observing the gait. We will know its base of support, weight-bearing stability, foot position, stride and length and cadence of stride, arm swing, and posture.